Welcome to this week's edition of Endocrinology Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. Biocon has received approval in India for its version of liraglutide, a GLP-1 receptor agonist for treating type 2 diabetes in patients aged 10 years and above. The approval was granted under CDSCO's new 101 route, which acknowledges international regulatory decisions. This marks Biocon's first vertically integrated GLP-1 offering. The launch will proceed through Indian commercialization partners. A new analysis reveals that pediatric type 2 diabetes is significantly underdiagnosed. While incidence of type 2 is rising faster than type 1 in children, many cases remain undetected. Researchers estimate that undiagnosed cases may be 10 times more prevalent than reported ones. The disease progresses aggressively in youth, increasing risks for early kidney disease and hypertension. Experts are calling for scalable and simplified screening methods, including modified oral glucose tolerance tests. In the UK, Nice has issued a positive recommendation for Sogroya, or somapacitan, for children aged 3 to 17 with growth hormone deficiency. Developed by Novo Nordisk, Sogroya offers a once-weekly injection option, replacing the conventional daily regimen. It is approved for both pediatric and adult patients with growth hormone deficiency. A coenzyme Q10 analog, Mitoquinone, has shown encouraging results in reversing early-stage heart failure linked to type 2 diabetes. In a 4-month study, participants demonstrated a 15% improvement in myocardial energy efficiency and reduced cardiovascular stiffness. Larger trials are planned to investigate the potential long-term cardiovascular benefits of this antioxidant therapy. In the United States, Sandoz has launched Wyost and Jubbonti, the first interchangeable biosimilars to denosumab products Xgeva and Prolia. These biosimilars offer more affordable options for the treatment of osteoporosis and cancer-related skeletal conditions. With over 10 million U.S. adults affected by osteoporosis, access to these alternatives could significantly improve care affordability and reach. A Chinese trial has demonstrated that Dapagliflozin, an SGLT2 inhibitor, offers dual therapeutic benefits in patients with type 2 diabetes and liver disease. 53% of patients receiving Dapagliflozin showed improvement in metabolic dysfunction-associated steatohepatitis, or MASH, without worsening liver fibrosis. The findings support its role in managing both glycemic and hepatic pathology. Researchers at Western Sydney University have developed an AI-based tool known as DRS4C to predict type 1 diabetes risk with precision. Using microRNA biomarkers, the tool was validated on 5,983 samples from 8 countries. It can differentiate between type 1 and type 2 diabetes and predict treatment responses, showing strong potential for early diagnosis and precision medicine. At the University of Virginia, the Adaptive Biobehavioral Control System, a digital twin-enabled artificial pancreas, has improved outcomes in patients with type 1 diabetes. Participants using the system increased time and range glucose control from 72 to 77% and reduced HbA1c levels to 6.6%. The platform allows for safe, personalized adjustments through real-time simulations. Stay ahead in endocrinology research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email